respiratory sound, which led me to believe that there might have been something stuck there, and it turns out there probably was, at least temporarily. So if you're breathing fine and everything's fine, it's most likely just some irritation, but if your breathing or anything changes, you should get checked. But yeah, be careful with those Mentos.
I know.
Okay, Gene. Thanks for the call.
Okay, thank you very much.
All right, take care. 902-405-6000 is the way to reach us for house calls with Dr. Gillis. Melissa, hello.
Good morning, Dr. Gillis. How are you?
Doing great.
I have a question. I'm a former patient. I was on the show a few weeks ago, and I have a question regarding, I guess, the Workers' Compensation Board. I don't know if you can answer it, and if not, that's fine. I want to know what your thoughts are on medical advisors stating that the doctors in the community are incompetent and don't know what they're talking about.
Well, God, do we have a couple hours on that one, Todd?
I know.
I deal with comp files all the time. I rarely see them saying things, advisors or tribunals, that the doctors are incompetent, but I do see a lot of language, saying, there's not enough information, or that, the doctor is not expert enough in this file, or they haven't provided enough info. It absolutely drives me crazy. I've learned enough over the years that, I use very specific language when describing things, which sometimes is more effective than just generalities. But, I encourage people who, have legitimate case concerns to, seek out workers' advisory and to ask for help in preparing an appeal and response. The biggest one that's driven me absolutely batshit over the years is medical marijuana through workers' comp. I mean, their guidelines.
That's what I'm with.
Yeah, there you go.
That's where I am. I'm a former patient of yours, so that's where I'm at. So that's what they're stating.
Yeah, so their guidelines are basically based on something that some random family doctor wrote 10 years ago, based on no evidence. They don't follow the trends of Veterans Affairs, of Health Canada, or really of experts in the field. I will say it has gotten better. I've been through, I think, 3 or 4 tribunals now where we've won, and those rules were set aside to the discretion of the treating physician. So there is some kind of hope on the horizon there, but it remains remarkably frustrating. And I'm more than happy to talk about it and tell them that they need to do better anytime I'm given the opportunity.
Okay, great. I may be referred back to you.
Okay. Thank you.
Thank you for your time.
All right, take care. 902-405-6000.